Despite having access to advanced biomedical technology, patients routinely seek out traditional therapies, herbal supplements, and community-based health rituals. These two worlds coexist daily. A patient might leave a state-of-the-art MRI suite and go straight home to prepare a raw botanical remedy. But there is a clinical paradox in modern healthcare. While patients actively combine these treatments, they frequently hide their traditional medicine use from their conventional doctors. They keep this information secret because they fear being mocked, judged, or dismissed by healthcare professionals who may not understand their cultural background. This blind spot has severe clinical consequences. When doctors do not know what botanical extracts a patient is taking, unmonitored pharmacological drug interactions can occur. It also leads to dangerous delays. Patients might rely on unproven home remedies while worsening symptoms go undiagnosed by a medical professional. Ensuring patient safety requires uncovering these hidden practices. Clinicians can only do that by fostering mutual respect and trust rather than immediate judgment. Consider this specific clinical scenario. A 54-year-old male patient arrives at your clinic, previously diagnosed with hypertension. During the standard history-taking session, you review his digital chart and notice a severe red flag regarding his ongoing treatment plan. He admits he has abruptly stopped taking his prescribed antihypertensive medication for the past 2 weeks. In its place, he is relying exclusively on an unregistered imported herbal tonic that his family recommended. When asked why, he explains his belief that because the tonic is natural, it carries absolutely no side effects. This specific choice creates immediate physiological danger. Abrupt cessation of blood pressure medication dramatically increases the risk of severe rebound hypertension and cardiovascular events, such as a stroke. To manage this high-risk encounter effectively, clinicians must move past vague marketing labels like holistic and deploy precise academic taxonomy to evaluate the therapy. The first step is defining the use context. This classification describes exactly how a therapy interacts with conventional medicine, rather than evaluating the therapy itself. We define complementary medicine as a non-mainstream practice used safely alongside conventional medical care. For instance, a patient undergoing active chemotherapy might receive gentle massage therapy to relieve anxiety and physical discomfort. The two treatments run parallel. Alternative medicine is a non-mainstream practice used in place of conventional medical care. An example would be a patient choosing an unproven herbal mixture instead of undergoing recommended surgery for a serious condition. Because our 54-year-old patient stopped his prescribed medication, his herbal tonic represents alternative use. This specific context drastically elevates his clinical risk profile. Once the context is established, we must define the scope of traditional and complementary medicine to understand exactly what alternative therapy is involved. This chart maps the scope of T&CM. It requires distinguishing a whole medical system, like Ayurveda, from a single modality. We plot the patient's herbal tonic directly under the natural products category. It is a single botanical modality, not an entire medical system. Categorizing the tonic precisely as a single modality used alternatively forces the clinician to immediately prioritize rigorous safety screening. That safety screening requires cutting through promotional language and commercial health claims. Vague statements like herbal tea cleanses the body create clinical ambiguity. They offer no measurable metrics for patient care. This is the claim ladder. As an academic clinician, you must use this analytical tool to convert broad marketing statements into testable clinical inquiries. Starting from the broad claim, we move to specific use. We must ask what exact symptom or condition this herbal tonic is supposed to treat. Next is population. We define who is taking it, noting the patient's exact age of 54 and their baseline kidney and liver function. The third step is outcome. We need to determine how the patient plans to objectively measure recovery or success in lowering his blood pressure. Fourth is safety. We ask about the specific dosage limits, potential organ toxicities, or interactions with other drugs. Finally, we demand evidence quality. We look for the clinical trials, pharmacopoeias, or systematic reviews that actually support the product's claims. The label natural is scientifically meaningless until the product survives this rigorous step-by-step scrutiny down the claim ladder. With the exact claims identified, we apply the 4-lens framework. This is the final diagnostic tool to structure the clinician's response to our patient. Activating the evidence lens, we find a complete lack of scientific or historical data supporting this specific imported tonic as a treatment for hypertension. Through the safety lens, we recognize the threat of undeclared heavy metals, contaminants, or powerful interactions inside unregistered herbal products. The culture lens reveals a choice driven by local knowledge, family trust, and a desire for holistic balance. The patient is viewing his health through a cultural framework that clinicians must acknowledge to maintain a connection. Finally, the regulation lens shifts our focus to the legal and professional parameters governing the healthcare facility. Under Malaysia's Traditional and Complementary Medicine Act 2016, this imported tonic fails the Ministry of Health's strict product registration standards. A responsible clinical assessment weighs physiological danger and rigid legal standards directly against these deep-rooted cultural beliefs. The ultimate goal of these encounters is integrative medicine. This is coordinated, patient-centered care that combines conventional and evidence-informed complementary therapies within safe professional boundaries. Reaching this goal requires balance. Uncritical acceptance of the patient's alternative choice is a failure of medical duty and professional negligence. Conversely, dismissive mockery of the patient's family tradition destroys trust, practically guaranteeing the patient will withhold vital information in the future. The ideal clinical response starts with validation. You explicitly acknowledge and appreciate the patient's desire to support their own health using natural remedies. Second, you respectfully but firmly state the immediate physiological danger. You explain that stopping his prescribed medication suddenly can cause life-threatening spikes in blood pressure. Then you propose a collaborative solution. You offer to review the safety and legal registration of the tonic together while immediately restarting his medication to keep his blood pressure safely controlled. Precise T&CM terminology provides the communication framework required to save lives, uphold legal standards, and maintain doctor-patient trust in modern clinical practice.